Okay, so let's talk about some of the potential downsides. I mean, one of the things that I've heard people talking about is AI bias. So how does that kind of play into SAMD?
Yeah, so that's like a huge issue, and it's something that people are, really thinking about a lot. And basically, it boils down to the fact that AI algorithms are only as good as the data that they're trained on.
Uh-huh.
So if that data reflects existing societal biases, then those biases can be amplified by the algorithm.
So like, for example, if a SAMD is trained mostly on data from one demographic group,
Right.
then it might not be as accurate or effective for patients from other groups.
Exactly.
And that could lead to, misdiagnoses or inappropriate treatments, and then ultimately that could actually worsen existing health disparities.
Exactly. Yeah, and it's a big responsibility for developers to make sure that their SAMDs are being trained on diverse and representative datasets.
All right. That's a really important point, yeah. Another concern that I've heard about is the black box problem. Can you kind of explain what that is and why that's a challenge for SAMD?
Yeah, so the black box problem basically refers to the fact that with some of these AI algorithms, even the developers don't really understand exactly how they work. So they can't fully explain how the AI is arriving at its conclusions.
Oh, wow. So a doctor might get a diagnosis or a treatment recommendation from a SAMD.
Right.
But they don't really understand the reasoning behind it. That seems kind of problematic.
Yeah, it is. And it's how can you fully trust the AI's judgment if you don't even know how it's making decisions? And that leads to questions about accountability, especially when it comes to patient safety.
So how do we kind of balance the incredible potential of SAMD with these very real challenges?
Yeah, that's the million-dollar question, and that's what we're going to get into more in this deep dive, looking at all the ethical considerations and the regulations and all that stuff and how that's going to play out.
That sounds good.
Yeah.
I'm definitely interested to hear more about that.
Yeah.
Okay, so we'll be right back after a short break.
Okay, so we've talked about the potential benefits and the challenges of SAMD, but I'm kind of curious about the human factor. How do doctors and patients feel about having AI involved in their healthcare?
Yeah, well, that's where this story about Rob and Zeb gets really interesting. The hospital where Rob worked decided to implement Zeb, but they were very careful about how they did it.
Okay.
So they didn't just throw the technology at the doctors and say good luck.
Right.
They really recognized that human expertise was still crucial.
Okay.
So they decided that only experienced radiologists like Rob would be allowed to use Zeb.
Mm-hmm.
And they would treat Zeb's recommendations as a second opinion.
So it's more like a consultant than a replacement.
Exactly. Yeah.
Okay, what about the patients? Were they even aware that AI was being used in their care?
That's interesting. So the patients knew that the hospital had implemented Zeb?
But their reports never actually said whether Zeb had been consulted in their particular case.
Interesting. So from the patient's perspective, it was kind of seamless.
Right.
Huh. Yeah. Okay, so that raises some interesting questions about transparency and how do we communicate with patients about the role of AI in their healthcare?
Exactly. Yeah, it's a conversation that we definitely need to have as a society.
Yeah, absolutely.
Yeah.
But going back to Rob and Zeb, how did that collaboration kind of play out in practice?
Well, Zeb's performance was definitely impressive, but the research highlights some unexpected consequences that go beyond just accuracy. One of them is this idea of de-skilling.
De-skilling, what does that even mean in the context of SAMD?
Yeah, so it refers to the potential for healthcare professionals to lose proficiency in certain skills if they're being handled by an AI.
Okay.
So imagine if a doctor became so reliant on a diagnostic SAMD that they stopped practicing their own diagnostic skills.
Oh, so it's if you don't use a muscle, it gets weaker.
Exactly.
Yeah.
And the research suggests that this could happen not just with practical skills, but also with things like judgment and decision making.
So doctors might become less confident in their own assessments and more likely to just defer to the AI.
Right.
Even if they have doubts.
Exactly. And that really highlights the importance of viewing SAMD as a tool to enhance human capabilities, not to replace them entirely.
Right. Okay, so how do we strike that balance? How do we prevent this de-skilling while still taking advantage of the benefits that SAMD can offer?
Yeah, well, the research suggests that one way is to really focus on training and education.
Okay.
So doctors need to be trained not just on how to use the SAMD, but also how to critically evaluate its outputs and maintain their own clinical judgment.
So it's about using it as a partner, not a crutch.
Exactly.
Yeah. Okay. And that brings us to another kind of important consideration, which is the potential impact of SAMD on team dynamics.
Right.
So, like, instead of improving collaboration, SAMD could actually make teamwork more difficult?
It's possible, yeah, especially if it's not implemented carefully. So, like, imagine a team of doctors who used to work really well together, sharing information, making joint decisions, and then you introduce these multiple SAMD systems that don't necessarily communicate with each other.
Right. It just adds like another layer of complexity.
Yeah, right. And it could lead to confusion and miscommunication.
Yeah, that makes sense.
Yeah.
So it seems like it's not just about the technology itself, but like how it fits into the human context of healthcare.
Exactly.
That's really interesting. Okay, so that leads to another kind of fascinating concept from the research, which is this idea of the paradox of accuracy.
Right.
The paradox of accuracy. How can accuracy be a bad thing?
Yeah, it's not that accuracy is bad in itself,
Okay.
but the research suggests that a really accurate SAMD might actually lead to worse outcomes in some cases.
It seems counterintuitive. How is that possible?
So, like, if a SAMD is so accurate that doctors just blindly trust its recommendations, they might stop questioning its outputs or considering other possibilities.
So even if it's right, most of the time, those rare instances where it gets things wrong could have serious consequences.
Exactly.
Because the doctors have become complacent.
Yeah, and the research uses this kind of thought-provoking analogy. They call it probabilistic tinnitus.
Probabilistic tinnitus. I've never heard of that.
Yeah, it's kind of a metaphor for how the presentation of SAMD results can sometimes distort a doctor's perception.
Okay.
So think of it like a ringing in your ears that makes it hard to hear other sounds.
Oh, okay.
So it's like the SAMD is creating this kind of mental noise that makes it harder for doctors to see the full picture.
Wow, that's interesting. So I guess the takeaway there is that we need to be mindful of how this information is presented to the doctors.
Exactly.
Making sure it doesn't lead to oversimplification or tunnel vision.
Yeah, and that's why the research emphasizes the importance of developing these SAMD systems that are what they call zebra-aware.
Zebra-aware. Okay, that's another term I haven't heard before. What does that mean?
So in medical education, there's this saying, when you hear hoofbeats, think horses, not zebras.
Okay.
Meaning that common conditions are more likely than rare ones.
Makes sense.
But sometimes those rare zebras do exist.
Right.
And missing them can have serious consequences.
Yeah, for sure. So zebra-aware SAMD would kind of help doctors keep those rare possibilities in mind.
Exactly. So instead of just giving the most likely diagnosis, it might also highlight unusual features or patterns that warrant further investigation or even suggest additional tests to rule out less common conditions.
Oh, that's cool. So it's like a safeguard against overlooking those critical cases.
Exactly. And it highlights the importance of designing SAMD in a way that supports human judgment and intuition rather than replacing it.
Right. So it's not just about making it as accurate as possible. It's about making it smart about it, how it presents information to doctors and helps them think critically.
Yeah, exactly. It's about finding that sweet spot where technology and human expertise work together.
Okay, so speaking of human expertise, I'm wondering about the impact of SAMD on the doctor-patient relationship.
Yeah.
Like, could this technology actually undermine that connection?
That's a really valid concern, and it's something that the research addresses directly.
Yeah, I mean, healthcare is ultimately about human beings caring for other human beings.
Absolutely.
Right.
And while SAMD has the potential to, free up doctors' time so they can spend more time with their patients, there's also a risk that it could create a barrier between them.
Right. I can imagine a scenario where, like, a doctor is so focused on, like, interacting with the SAMD that they kind of neglect the patient that's sitting right in front of them.
Exactly. Patients might feel like they're being treated by a machine rather than a human being.
Yeah.
And that can really erode trust and rapport.
Right. So how do we prevent that from happening?
Well, the research suggests a few key strategies. First, doctors need to be trained on how to communicate effectively with patients about the use of SAMD. Transparency is key.
So patients should know what the AI is doing, how it's being used, what it means for their diagnosis and treatment.
Exactly.
Okay.
And doctors to be mindful of how they interact with the SAMD in front of patients, making sure they're maintaining eye contact and listening attentively, and creating a space for open communication.
So it's about using it as a tool to enhance the doctor-patient relationship, not replace it.
Exactly right. Ultimately, successful implementation of SAMD is going to depend on finding that balance between leveraging the power of technology while preserving the human element of care.
So we've really, dug deep into this whole SAMMD thing.
Yeah.
All the good and the bad.